the common problems that people have when they come to see me is sun damage, obviously. And in that sun damage, a lot of times we find actinic keratosis, and that's just a fancy name for precancers that are caused from the sun that, if left untreated, could potentially turn into a form of cancer we call squamous cell carcinoma. I've had these myself. I've had way too many sunburns in my youth. And actinic keratoses present typically as little flesh-colored or pink, scaly or rough places, typically on the face, but really anywhere you've had sun damage. And we have many treatments, the dreaded freezing, which a lot of patients have had and don't love. We have creams, and we have, you can biopsy them. But one of the things that we've all as dermatologists tried to get to over the years is doing more of a field treatment for sun damage and for actinic keratoses, as opposed to just spot treatment. So typically in the past, we would just freeze each one we saw. But then we realized if we could treat the skin that is going to develop the actinic keratosis later, it'd be better to do that as a preventative and also treat the ones that are already there. And that's where PDT, or photodynamic therapy, comes into play. And a lot of people know it as blue light because it is in fact a blue light, not ultraviolet light, which it kind of looks like. It's blue light, which is part of that visible spectrum, the Roy G. Biv that we all learned growing up in science, the red, orange, yellow, green, blue, indigo, violet. And the specific blue wavelength, when paired with the topical medicine that we apply, those two together preferentially kill off the precancerous cells in the skin and leave the normal skin alone. And so we were able to really treat a whole area, whether it be a whole face or an entire scalp of a man or arms or legs, and we can really just get everything in that area treated and kind of cleaned up from sun damage in just a couple of treatments. The good news too about photodynamic therapy or blue light is it's most often covered by insurance. So that's really beneficial for patients.